Now, fetal well-being. Now, to evaluate for the fetal well-being, we can use two major instruments. The best instrument which is used is a cardiotocograph. Is it clear? And the cardiotocograph, we use machines called the dynamometer, or we use the intrauterine catheterization to visualize it. Is it clear? So we use tocodynamometer or intrauterine catheterization to measure these cardiotocographs. Is it clear? So the difference between both of them is that the intrauterine catheterization can measure the intensity of labor, while tocodynamometer cannot measure intensity. But apart from that, other elements going to measure. So you use the cardiotocogram in order to visualize for the fetal well-being. And this part here, which is for tocograph, is going to measure the different fetal heart rates. Is it clear? So the tocograph, is involving the cardiograph. The cardiotocograph is made up of two elements. It has cardiograph and it has tocograph. The cardiograph is going to measure the fetal heart rate and the different parameters of the fetal heart, while the tocograph is going to monitor labor, to monitor the uterine contraction. So now, apart from this, we can also use a pathogram. Is it clear? A pathogram in order to monitor labor, the fetal well-being of labor. Is it clear? So now let's understand this. So I'm going to use the different parameters of fetal well-being that we must know. The first parameter, we have the fetal heart rate. Is it clear? The fetal heart rate is the first parameter. The second parameter is the fetal heart variability. Is it clear? And then the third parameter is the fetal heart acceleration. Is it clear? Now, the fetal heart rate is just defined as what? It is defined as the fetal heart rate is the number of beats. Is it clear? The number of beats of heartbeats per minute. That is the definition of the fetal heart rate. The number of heartbeats every minute is the fetal heart rate. Is it clear? Now, the fetal variability is defined as what? In the fetal variability, when you have fetal variability, it is the variation of the fetal heart rate every 15 seconds. Is it clear? It is the variation of the fetal heart rate every 15 seconds. Is it clear? So those are the different things every 15 minutes. So the variation of the fetal heart rate every 15 minutes or 15 minutes is going to be the fetal heart rate. So every time you have a variation of the fetal heart rate, it's called the fetal variability. Now that variation is actually what? Normally after a certain period of time, depending in which the context you are, there are sometimes people say 15 minutes, some people may even go to seconds. Is it clear? So let's say that after a certain period of time, let's say like 15 seconds, you may have a variability. At one point in time, the fetal heart rate may be 126, and after 15 seconds, you have fetal heart rate of 25, of 110. Is it clear? So you see that after that period of time, which is 15 seconds, there is supposed to be a variability in the fetal heart rate, and the normal variability of fetal heart rate has to be between 5 to 20 variations. Is it clear? The normal variability has to be between 5 to 20 variations. Now the next thing is the fetal acceleration. Is it clear? Fetal acceleration is referred to as the rate of increase, the fetal heart rate 2 minus the fetal heart rate 1, is equal, all divided by the time of the acceleration. Is equal. So this is what is called the fetal acceleration. Is the second fetal heart rate minus the first fetal heart rate divided by the time of the acceleration. Is equal the time of the change in the fetal heart rate. That is called the fetal acceleration. And normally the fetal acceleration and deceleration has to be more than 10. It has to be between 10 to 30. Is it clear? The normal fetal acceleration has to be between 10 to 30. Is it clear? But now you need to know that what, and the normal fetal heart rate has to be between 110 to 160. Now, when using the cardiotocograph, you have all these elements which can be calculated. You can calculate the fetal heart rate, you can calculate the fetal heart variability, and you can calculate the fetal accelerations. You can have all these three parameters, but in the cardiotograph, you can only calculate the fetal heart rate. Is it clear? Now you need to know that what, among all these three, the one that best characterize if there's an acute fetal distress is going to be the fetal variability. If you have a variability which is less than 5, or you have a variability, if you have generally a variability that is less than 5, is going to be associated with an acute fetal distress. A variability that is even more than 20 does not usually mean that there is acute fetal distress. But if you have a variability of less than 5, is usually the imminent sign that there is an acute fetal distress, though that patient may have a normal fetal heart rate. Is it clear? Now, in fetal acceleration just tell you if the child is sleeping or not, and also the fetal acceleration also tell you the etiology. Is it clear? The fetal acceleration can also tell you the etiology of the acute fetal distress. Is it clear? Now, so generally, if you have a fetal deceleration, it means that the child may be sleeping. Is it clear? So when you have a deceleration already, when you have a fetal deceleration, normally I said that the fetal acceleration is between 10 to 30. Is it clear? If it is less than 10, it means that there is a deceleration. Is it clear? If you have a fetal deceleration, you can think of the fetal sleep. Is it clear? So what are the the different relevance of all these fetal parameters? The first one is, let's talk about the fetal acceleration and the fetal celerity. Is it clear? In the fetal celerity, we have the first is fetal deceleration. Is it clear? If there is a fetal heart rate deceleration that is in between less than 10, is it clear? Less than 10 beats per minute square. If you have that, it means that there is usually a fetal sleep. Is it clear? And when there is a fetal sleep, in order to activate the fetus, you do now a fetal scalp massage. Is it clear? You do a digital vaginal examination, and then you palpate at the level of the fetal head. Is it clear? And you are going to see that the acceleration is going to go normal. Now, if you have now fetal acceleration, fetal heart rate acceleration, the fetal heart rate acceleration can tell you the etiology of the acute fetal distress, provided that there is acute fetal distress. Is it clear? And fetal heart acceleration means it's greater than 30.